Begin by placing the standing sling around the patient's back. Using good postures, sit the patient forward and bring the chest piece round and under the arms. Fasten it firmly using the clip. The standing sling is used to facilitate a standing manoeuvre in a patient who has the ability to participate in the move. The standing sling is a one-piece sling with the single purpose of assisting the patient up onto their feet. Open the legs of the lift and keep the handles at a high level so as not to intimidate the patient. Bring the lift in square. After measuring, raise the height of the adjustable knee pad to just below the knee of the patient, as this is the most supportive position. Place the patient's feet onto the footplate and rest their legs into the knee pad. For extra support, there's a calf strap that holds the legs in position. Although this is not absolutely necessary, it offers extra support if required, following careful risk assessment. The brakes are not required unless the patient has a great degree of leg extension. Bring the handles down to a safe height and to the level where the loops can be hooked on comfortably. Ask the patient to hold the handles firmly. This is a good position for their hands. Connect the straps to the lift using the correct loops. The general rule is that if the patient is quite tall, you would want a shorter loop. If the person is smaller, you would require the longer position. In this case, the orange loop is the most appropriate. Instruct the patient to lean back slightly into the sling and to participate with the move. The most important aspect of a standing aid is that the patient both understands and participates in the manoeuvre. This sling is not used to transport through a doorway or from room to room. For this, you should use the transport sling, which has leg supports. Raise the patient to a good standing position. Then, standing comfortably and squarely, walk backwards, holding the lift at a comfortable height. This is only used to transfer from chair to chair or toilet. The standing sling is particularly useful for the toileting procedure as it supports the upper trunk, leaving the lower area free for removal of clothing. Lower the patient slowly onto the toilet. Once the patient is on the toilet, the calf restraint can be unclipped. The sling can then be unhooked and the lift removed. To use the Arise lift to sit the patient down, bring it square to the chair as close as possible. Ask the patient to participate in the manoeuvre. This is as natural a sitting position as can be achieved with a piece of equipment. If the chair tips, it isn't a problem. As the patient's weight is transferred to the chair, they'll sit right down at the back of the chair, removing the need for any further repositioning.